is eye instillation. Eye instillation is the administration of the medication to the eye. Assessment. First, assess the patient for any allergies. Second, check expiration date before administering medication. Third, assess the appropriateness of the drug for the patient. Fourth, review assessment and laboratory data that may influence drug administration. Fifth, verify patient name, dose, route, and time of administration. Sixth, assess the affected eye for any drainage, erythema, or swelling. And the last, assess the patient's knowledge of the medication. Objectives: first, to directly apply the medications into the eye. Second, to provide means for eye evaluation. And the last is to obtain desired therapeutic effect. Step 1. Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergy. Rationale. These comparisons helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Step number 2. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medications to be administered. Consider the appropriateness of the medication for this patient. Rationale. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Step number 3. Perform hand hygiene to prevent the spread of microorganisms. Step number 4. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Rationale. Organization facilitates error-free administration and saves time. Step number 5. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Rationale. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Step number 6. Identify the patient by checking the name and identification on the patient's identification band. Ask the patient to state his or her name. Rationale. Identifying the patient ensures the right patient receives the medication and helps prevent errors.
Step number 7. Explain the procedure to the patient to gain cooperation and to allay anxiety. Step number 8. Offer tissue to patient. Rationale. Solution and tears may spill from the eye during the procedure. Step number 9. Cleanse the eyelids and eyelashes of any drainage with a washcloth, cotton balls, or a gauze moistened with normal saline solution. Use each area of the cleaning surface once, moving from the inner toward the outer canthus. Rationale. Debris can be carried into the eye when the conjunctival sac is exposed. Using each area of the gauze once and moving from the inner canthus to the outer canthus prevents carrying debris to the lacrimal ducts. Step number 10. Tilt the patient's head back slightly if sitting, or place the patient's head over a pillow if lying down. The head may be turned slightly to the affected side to prevent solution or tears from flowing toward the opposite eye. Rationale. Tilting patient's head back slightly makes it easier to reach the conjunctival sac. This should be avoided if the patient has a cervical spine injury.
Step number 11. Remove cup from medication bottle, being careful to not touch the inner side of the cup.
Rationale. Touching the inner side of the cup may contaminate the bottle of medication.
Step number 12. Invert the monodrip that is commonly used to instill eye drops. Have a patient look up and focus on something on the ceiling.
Rationale. By having the patient look up, the procedure is less traumatic and keeps the eye still. Step number 13. Place thumb or 2 fingers near margin of lower lid immediately below eyelashes and exert pressure downward over bony prominence of cheek. Lower conjunctival sac is exposed as lower lid is pulled down. Rationale. The eye drop should be placed in the conjunctival sac, not directly on the eyeball.
Step number 14, hold dropper close to eye but avoid touching eyelids or lashes. Squeeze container and allow prescribed number of drops to fall in lower conjunctival sac. Rationale, touching the eye, eyelids, or lashes can contaminate the medication in the bottle, startle the patient, causing blinking or injure the eye. Do not allow medication to fall into cornea. This may injure cornea or cause the patient to have an unpleasant sensation. Step number 15, release lower lid after eye drops are installed. Ask patient to close eyes gently. Rationale. This allows the medication to be distributed over the entire eye. Step number 16. Instruct the patient not to rub affected eye. Rationale. This prevents injury and irritation to eye. Step number 17. Perform hand hygiene. Rationale. Hand hygiene deters the spread of microorganisms. Step number 18. Assist patient to comfortable position. Rationale. This ensures patient comfort. Evaluation. First, patient cooperate with installation of eye medication. Second, desired therapeutic effect is obtained. And the last is experiences no adverse effects including allergy response, systemic effect, or injury.